Amanda Ragusio, registered physiotherapist and clinic manager at Propel Physiotherapy, Pickering. I recently had the pleasure of sitting down with our newest team member, Dr. Allan Drayton, to talk about his practice and his holistic approach to the healthcare services he is now offering to our Pickering clients, which include chiropractic care, massage therapy, and acupuncture. He has a wealth of experience and skills that make him a valuable addition to our team here in Pickering. I'm excited for you to get to know him better by watching this video.
My true nature is very holistic, and based on my history and education and training, chiro first, been a chiro 16 years this month. Then came, I guess, acupuncture and massage came around the same time. I've been doing medical acupuncture, or the contemporary acupuncture as they call it, for about 15 years, because I did that 1 year after I finished the chiro college. And then I started doing TCM acupuncture, traditional Chinese medicine acupuncture, in 2017. So fast forward that, now we're here. And I did my massage after that during COVID because I was home and I didn't have much to do. Everything was locked down. So I figured, why not add to the mix of all the knowledge that I have? And here we are. So I've always had a passion to be in medicine, but I didn't want to be in the traditional medical system. I've always believed in alternative care and the body having the natural ability to heal itself. So once I finished my undergrad, I decided to look into the alternative medicines, and everything came up. TCM came up, massage came up, physio came up, chiropractic came up. And as I looked into all of them, what spoke to my heart was the chiropractic mantra. And then I looked at their course curriculum, which I fell in love with just looking at it. So I took that route, but some way, somehow I knew I would have ended up doing some of the other things. And my aim from the initial evaluation, as I approach it holistically, is to allow that person to understand that their health is bigger than the problem that they came in, and try to enforce that with them and meet them where they are. So some people need more strength training. Some people need more psychological well-being. Some people need more nutritional support. Some people just need some motivation to become more active. So I try to feel the person out and see, how best I can help them achieve what their ultimate health goal is, rather than what is the reason that you came in to see me. Back pain, I mean, that's a typical run-of-the-mill situation, but the back pain can be, reduced to, how are you sleeping and all of these different things too, right? To say I can separate all three, it's very difficult. Because all three are so integrated and there's so much overlap, more overlap than not. So it is very hard for me to say it's going to be strictly chiro. That means I have to forget everything I learned as a massage therapist or acupuncturist. And like I said, there's overlap. So my evaluation would be, I believe, I don't want to say atypical, but it is atypical, because regardless of what the person is coming in for, I'm treating the person. I'm not treating the condition. So I don't have a typical evaluation. I do the things such as range of motion, strength testing, neuro, depending on what the person complains about. But a lot of things like their sleep, their stress levels, their activity levels, when last they've seen their medical doctor to do general blood work, all of those things are a big part of my initial evaluation. Even I talk about it even as a massage therapist as well. I do have to stay within my scope of practice in all three disciplines. But like I said, there's a ton of overlap. So it's not atypical, but it's not typical. It's very selective to the person, what they're coming in for. I'm not going to do neurological for everyone. But if I do suspect, or even if I think there may be some inkling of that, then I would do it. So it's very thorough, I would say, very thorough, because I try not to leave any stone uncovered. So there are some people that love being adjusted, some people that don't like being adjusted. For instance, I had a patient this weekend that was sent to me by a physiotherapist, and she says, I hate chiropractors. I don't want my neck adjusted. I have osteoporosis. And I started laughing. And by the end of it, she said, you're awesome. And I said, so are you. So it's not to pat myself on the back. The reason being is that every discipline, there are good lawyers, there are bad lawyers. There's good this, there's good that. My job really is to help somebody. And it's not about my ego, it's about what their needs are. And as long as we can put that on the table and make that the first and foremost thing that the person is there for, and I gain their trust, then we're able to do what is the best situation for that person. And sometimes they don't want to do something, but they may they give consent because I'll explain what the risks are, what the pros and cons, what they have to gain. And then we compare it to all the other types of therapies that might be out there. So for me, I don't have to adjust. I love adjusting. In some cases, somebody might come in and after an evaluation, I think an adjustment is the best thing for them. And they give the consent, we do it. If not, we'll find a different way. So I have all these different tools, and physios do as well too. I would say I practice a lot more as a physio than a chiro, and I'm not saying that to belittle chiropractors or try to elevate physiotherapists. But the Canadian chiropractor from CMCC has learned a ton of modalities. A traditional chiropractor, the word chiro means hands. So the traditional chiropractor will probably look at us and frown at us because they think that adjustments should be the end all be all. I don't believe that. I believe I can talk to somebody, and if their sleep was what needed to be helped and that's going to help them, I don't need to adjust them. If it was a nutritional deficiency, why adjust them? So, it comes down to the person, their needs, their wants, but then they're coming to me for me to educate them, give them some clinical guidance, and then we can choose what's the best course of action for them. And hopefully they trust me. A lot of times it's an experiment. I don't know how things are going to go, and I tell them, you're an experiment for me. We're going to go on this journey together. I think this is going to help. But when you go out from here, I don't know what you're doing. When you go out from there, it's more of the therapy. When you come in here, it's more of the education. And when we put things together, chances are we're going to be able to defeat this and have a better quality of life. And that's it. So adjustments, I love doing. I'm great at it. But I also do acupuncture. I also do a ton of soft tissue. Education is probably, the number one thing that I would say I'm able to give people from my experience as well. But Chinese medicine is not just acupuncture. It's a way of living, really. It's understanding our environments and understanding our part in nature, that we are one with nature. So, having that thought process helps me to be able to help anyone with any sort of disease, really, because we're treating the person, it's holistic, and we're not just treating the disease itself. So it's anything that somebody has, Chinese medicine, actually acupuncture, because I don't practice the herbs part of it. The herbs are let's liken that to, prescription medication then. So you have prescription herbs that you can take. But acupuncture can be used in that a line of thought as well, where any disease, any issue, whether it's stress, whether it's constipation, insomnia, just educating the person. Again, Chinese medicine has their way of living and way of educating people in terms of their way of living to help them with their diseases. So I'm a huge advocate for exercise. I think exercise is the best tool to treat and ward off diseases, and it's free. So that's one thing I really promote. But as people get to know me, what they will understand and what I try to portray is a good-natured person that wants to live life to its fullest in the way of not being bogged down by all the negativities, regardless of what's out there, and be able to use that to drive health. Because the way you think, what you surround yourself with, the air you breathe, all of these choices that we have that we take for granted and that we don't really put too much effort into, can make or break our health. They are health choices. And if I can get people to understand that, then they would be able to make better health choices themselves and have a better quality of life. So I don't typically work with kids, not
That
for
was
any
my next
other
question.
reason. Yeah, not for any other reason than I think there's so much. So unless it's an injury, let's say it's a sport injury, and that's one thing. Um, I don't have the belief where kids have to be adjusted to have a better life. I don't believe that. And if a parent came to me and asked me to adjust their kids because they believe that, I would educate them. And if they insisted, I would do it because it's in they think that that's their best interest. So I will help them with that. But I think kids should play and grow and develop. And probably when they're in their teens is where I would be able to start really making some headway with that. But before the age of 10, I would say, or even 11, 12, that's kind of a gray area. But before that, not really, unless they came in with a. Issue that they had. But for wellness purposes, I don't see the need. For those who don't know, I'm married and I have 5 wonderful children. So my time is really devoted to my family. Next to my family, my love is soccer. But outside of soccer, I am very much interested in everything. I have a keen desire to learn a little bit of everything, whether it's playing a new instrument. I'm learning a new a language. I'm learning Latin. That's something that I've always wanted to do, learn a new language, because I speak 2 languages, English and very bad English. So you can pick either one to communicate with me. But yeah, so I have a love of learning, history, space. My youngest is 7, and she is very interested in the universe, and she's opened my eyes to that as well too. So, looking at a telescope or just looking at videos on YouTube about the universe, there's just so much to learn, so much to grasp. So I have an interest in. You talk to me about something, I'm gonna be like, oh my gosh, that's pretty cool, and I'll probably start looking at it on YouTube. So yeah, my love is learning. But besides my family, it's soccer. Everything and anything about soccer. Mainly, my treatments are from my heart, really. I love what I do. I really love. I feel blessed that I'm able to practice and have been able to learn what I have learned and be able to, incorporate all of those things together to make it more of a unique experience for every individual. And I'll have to cap it off by saying, like you had said before as well, that it's each person, each treatment, it's very specific and very individualistic to that person. I'm happy I can say I get to practice like that.
I hope you enjoyed getting to know Dr. Allan Drayton better. We're so happy to have him as a part of our team here in Pickering. We've heard nothing but great things from the clients he has treated so far, and even some of our staff members, just rave reviews. If you're interested in booking with Dr. Allan, just contact our clinic at 905-420-7975 or email us at info@propelphysiotherapy.com.